Sampikat. Sampikat. L'altra una de xoc. No senties? Hello, good morning. Is that okay? Perfect. Hello, good morning to everyone. My name is Jaime Sabate. I'm the technical applications trainer from Beco Medical Company. We are making some demonstrations on the booth that we have in Cosmoprof Bologna. This is Beauty Fair. And in this case, now you can see that we are demonstrating about our device called AdipoWave. That is a radial shockwave therapy device. For those that you already know about this technique, you know that it's a mechanical technique. So here inside this handpiece, there is a system that will make some shocks, some impacts on the surface on the skin, and then we can treat several things with this technique. We can normally treat aesthetics. We can treat cellulite, we can treat fat tissue, fibrous fat tissue. We can promote the lymphatic drainage. We can improve the muscle tone. So it's very, very useful in this field. Okay. For instance, now, what are we doing on our model, on Carolina, Carlota? We are making a shockwave, okay, to reduce, okay, the density, the deftness of this accumulus of fat tissue here on the hips. So, it's very simple because the only parameters that we have to introduce on the screen of the machine are two: the frequency and then the power. The frequency will be belonged to the depthness of the stimulation of those shock waves. So that means that if I want to work very superficial, I have to parameter the machine around 16, 15, 14 hertz. And then if I want to increase the depthness, I have to decrease the frequency. And the same thing with the power. If I want to go deeper, I have to increase the energy. And the same thing for the opposite. Okay, if I want to stay in the first layer of the skin, I have to decrease the energy or the power. That's right. The average power, it will depend on each patient, because if we are treating cellulite, there are people that they have a soft cellulite, there are people that they have a hard cellulite. So it will depend even on the tolerance of each one. That's right. For instance, in Carlota, in this hip of Carlota, I recommend her to work around 8, 9, 10 hertz and probably around 90 millijoules. Our machine can deliver an energy that goes from 60 millijoules until 185 millijoules. That's right. And with the frequency, we said that we can go from 1 Hz until 16 Hz. And then another thing to decide is the number of impacts that we will deliver on this surface. For instance, if we go here to this program that it's called Cellulite, okay, we can see on the screen that the average number of impacts that we recommend are 3,000, 4,000 impacts. That means that for a surface of 200 square millimeters, we have to deliver this amount of impacts. In the first treatment sessions, we will stay around 3,000. And after that, we can increase it if the client feels comfortable, okay? And if there are not secondary effects after the treatment session, okay? So once we selected the program, we parameter, okay, everything here on the screen. We apply a little bit of oil, or in this case, glycerin, just to be able, okay, to move the handpiece all over the surface of the skin. That's right. And in this case, because it's a 400 square centimeters area, I have to add, okay, more impacts, around 6,000 for this area of the hip. That's right. The first impacts that I will deliver to Carlota will be very, very soft. So I simply, okay, put the handpiece like this in vertical, and then I will travel across the skin quite fast. That's right. And after that, the same thing in horizontal. That's right. So that will be at the first time, the first number of impacts, around 1,000. After that, I will do, okay, the same, but pinching the skin or the fat tissue, okay. So trying, okay, to impact on the surface of the adipocytes of the cell membrane harder, okay, to promote the lipolysis. That's right. Easy, isn't it? Okay. Here you have the pedal, okay, on the floor. So we apply the handpiece, we press the pedal, okay, and we start. Firstly, we set to go fast across the surface of the skin like this. I am not pressing the handpiece. I simply let it on the surface and I move it quite fast, avoiding, okay, to have a bad contact. So it's very important to have a good contact with the surface of the skin like this. That's right. So now we are checking the tolerance of the treatment by the patient. In this case, Carlota, as you can see, she doesn't have a lot of deafness of that tissue. It's not very thick, it's quite thin. That's right. So the first impacts must be like this, very, very easy. So now we can decrease, okay, a little bit the frequency. So if we started around 14 hertz, now I can go until 10 hertz. I can increase a little bit the energy, for instance, from 60 millijoules until 90 millijoules. I can do the same movements, but now slowly and now logically pinching a little bit, okay, just to be able to, okay, trying to crush the cell membrane, or at the minimum, to promote the lipolysis. So now I go slower and I pinch a little bit, okay, so the positive movement, it's quite slow and pinching, and the negative movement, I go there, okay. We have to avoid to impact on the bones, but in this case there is a small amount of fat tissue up on the bone, so there is no risk of damaging the bone. And obviously we cannot damage the muscle because it's soft. Okay, so it's quite easy. And now I am pressing a little bit the handpiece against the surface of the skin. Just a little bit, not much. So I move like this. I come back, and once again. In this sense, and now in horizontal sense. That's right, so I treat all these 400 square centimeters area. After a while, as you can see, there is some redness that will appear on the surface of the skin. That means that we are increasing the blood supply of the tissue. So we are increasing the microcirculation on the skin. Perfect. Okay, and now the third thing that we can do on a cellulite tissue, okay, could be to decrease those holes that sometimes appears on the buttocks or in the back side of the thigh, okay. So we can imagine that Carlota has those holes on the buttocks or here on the thighs, and now we will decrease a little bit more the frequency. We will increase a little bit more the energy, okay? We will put the handpiece up on those holes, okay? And I do like this, and I simply have to make this movement, that is static movement, in each hole that I see on the surface of the skin. That's right. I'm not pressing much, just a little bit. Okay. Around 200 to 250 impacts. I choose another hole and I do the same procedure like this, avoiding to have air between the surface of the handpiece and the surface of the skin. So I simply press a little bit and I do this movement. Okay. 200, 250 impacts, and we can perfectly treat all, okay, of them. After that, if we want, we have to promote the lymphatic drainage in here inside, okay, to allow the body, okay, to take off this melted fat. We can do it with a pressotherapy device, or we can do with the shockwaves. That's right. The lymphatic drainage is very superficial, so we have to change the frequency. We have to go maybe until 16 hertz, okay? That is the more superficial effect, and with a very low energy, 60 millijoules. That's right. And now, like this, I'm not pressing, so I simply go very easily like this, and I try, okay, to give a hand to the lymphatic drainage system of the patient, like this. Quite simple, quite easy. And like this, we are very sure that everything is being moved until the lymphatic nodes of the body, okay? And there cannot be a restocking effect of this melted fat. Okay, perfect. So, for instance, that could be the way to proceed with a cellulite here on the hip. After the treatment, some redness, excellent. That means the increasing of the blood supply on the epidermis, and even some heating, more inside, less outside, but it's quite easy to feel it. That's right. So after that, we can perfectly clean the skin. So we take some paper. We clean it. That's right. And after that, the patient can perfectly do everything that she wants. Okay? She can go exercise, she can go working, she can go every day. That's right. So we clean it. Perfect. And we can repeat the treatment in every area that we want. Okay? We have to be careful to not deliver a lot of time of this procedure, okay, because it can be, we can say, a little bit damaging for the lymphatic nodes and lymphatic system, okay? That's the only thing. So maybe it would be 15 minutes, maybe 20 minutes per day, not much, okay, not more. Excellent. So now you saw a demonstration of this device, AdipoWave system, okay? So now, after a while, we will continue with more demonstrations of our devices here on the booth, okay? So see you in a while. Thank you very much. Goodbye. Muy bien, Carlos, ¿qué tal? ¿Sí? Perfecto.